All right, welcome back to Pharmacist on Call. Your host, your community pharmacist, Dr. Sean Pruitt. I just wanted to do a little breaking news, and I forgot to mention at the beginning of the show. For all of you gentlemen and all you ladies out there who are interested, Pruitt's Discount Pharmacy now carries the generic form of Viagra, sildenafil, and it's probably going to be pretty cheap. So we'll discuss the details off of the air. So give me a call at the store. Generic Viagra available at Pruitt's Discount Pharmacy. So give us a call. We're going to get right back into your phone calls. We've got Angela on line 1. Angela, welcome to Pharmacist on Call. How may we help you?
Yes, trying to find something that is not a drying agent for excessive mucus buildup, where mucus plug close the throat from allergy attacks.
Okay, let's try. Have you heard of sambucus, elderberry sambucus?
Sambucus?
Elderberry, ELDERBERY,
Okay.
And it's an herb. It's a berry, but it is a mucolytic, and so it will break down that mucus. You probably need to drink plenty of water with it.
Okay.
Yes, I would try that one.
All right.
Yeah, so I assume you're taking Benadryl and it's really drying you out?
Yes, I can't use any drying agent.
Okay. Yeah, the antihistamines are going to do that simply because of the anticholinergic effects. But yeah, I think elderberry will help you out there.
Okay, thank you.
Yes, ma'am, you're welcome. All right, looks like we've got line 2. Janice, welcome to Pharmacist on Call. How may we help you?
Yes, I am a diabetic, and two things. I want to know the cost of the juice, and is there a guarantee that it will reduce my A1C?
Okay. Question 1, it is $15.99. After tax is $17.47, and this is about it's about a liter, so it lasts you about a month doing one shot, and there are no guarantees. I can't even guarantee you that my prescription medicine will even work. But if you were standing in there and my patients heard you, they would give you a church sermon about this and the water. So yeah, I've got plenty of testimonials. So if you come in the store and ask about it, chances are someone in there is already using it, and they can give you a full sermon about what it's done for them. Is it effective? Yes. Do I use it myself? Yes. Does it work on me? Yeah. So my staff, I think at least 2 of them drink it. So give it a try. But $15.99 for those of you viewing beetroot juice. All right. Looks like we've got Frida on line 3. Welcome to Pharmacist on Call. How may we help you? Hello, Frida?
Oh, hi.
Hey.
Yes, this is Frida, and I'm watching you right now.
Yes, ma'am.
You're a looking young man, too. I got 4 questions.
4?
I've seen you on the air before, but I never got a chance to get into the...
Okay. Yes, ma'am.
First of all, I have COPD.
Okay.
It's linked with asthma, bronchitis, asthma, and sinus. I just got out the hospital. I went in Christmas Eve, came out Christmas Day, went back 12 days later. I got a viral infection in my lungs, which they call it asthmation. Saying that I picked up something, I walked in the gas station, came out and fell sick. And so they rushed me. I got in the hospital. They rushed me to emergency room. They treated me for 2 hours. Treatment. I stayed in MICU for 4 days. I never got any closure except stay out the weather. Now, I want to know, I've been had this since I was like about 20 years now. I'm 61. I'm trying to go in and out the hospital. Is there anything, any herb, because I've been watching Dr. Sabi from Europe in the UK, and he's got all these herbs and spices for people who have different things, and he said it comes from our mucus. Our mucus carries a lot of diseases. So I need some help.
Okay, so when you went to the hospital, you said they gave you a treatment. Was this a breathing treatment?
Yes,
for 2 hours?
Steroids to open up my lungs.
Okay. Okay, so when you left the hospital, what did they diagnose you with?
They didn't tell me. They just said that I had a viral infection. But when I checked my paperwork, it said, "Has this patient been checked out for?" And it said, "Community immune pneumonia."
Community-acquired pneumonia.
They told me I didn't have it, but on the paperwork it said they checked me for it. So I know they diagnosed me with it, but I got mad at the doctor and I told him a few words, but I didn't cuss.
Okay, good. All right, so it looks like they didn't necessarily diagnose you with pneumonia, but they just checked you for it to rule it out. So are you a cigarette smoker by chance?
No, sir.
You said no?
No, sir.
And they diagnosed you with COPD?
I've been diagnosed 10 years ago.
Okay. What medication were you on for that?
It's, they got me on prednisone, albuterol, Symbicort, and it's another one that I take. They're all inhalers. And now they got me on high blood pressure medicine because it said I'm hypertensive. It's called LIP. I can't pronounce it.
It's probably lisinopril, because what can happen with some of the asthma medications, they have an adrenergic effect, so they can push your blood pressure up and probably make you a little sleepless too.
Yeah, I do sleep.
Yeah. I think we need to find out what your condition is before we can recommend, because for the most part, we would just have to treat the symptoms that we see. So did they do any type of bacterial culture?
They did everything.
Okay.
I had 6 blood cultures. They took blood. They went in my arteries. They took blood. They took chest x-rays, heart x-rays, neck x-rays, CAT scans,
and no diagnosis?
Every day they gave me heparin shots. They gave me magnesium. They gave me some other medicine. One medicine made my head itch so bad I thought it was on fire, and the nurse didn't even say anything. She said, "Okay, I'll tell the doctor."
Okay, so what is your main complaint physically? It's the constant going back to the ER because of shortness of breath?
Yes. Okay. I mean, I'm sitting up here now and I'm short of breath.
Okay.
But I have my rescue inhalers and stuff. I could go from here to the bathroom and have an asthma attack.
Okay. You changed the filters in your place?
They change them. Where I live at, they change them every month.
Okay. Now, when you're going outside, what's happening is as you expose your lungs to that cold air, the body's reaction is to protect you. And so to protect you, your lungs and your bronchioles, they tighten up. And that is to keep out anything that might be in the air, that can trigger or what the body might see as being harmful to you, whether it's a cold air itself or it may be trying to protect you from a bacteria or a virus or what have you. And so part of that protection defense, it's going to cause shortness of breath because your bronchioles are tense. So what the steroids do is they relax it, kind of tell your immune system to quit tripping and let your lungs open so that you can breathe. So does this happen when you go outside when it's really cold?
Oh, yeah. It immediately just stopped. I have to go back inside.
Ask your doctor if they think maybe you going out with a scarf or one of those masks to where you're not exposed directly to that cold air hitting you would help you.
I have some masks. They gave me masks to wear.
Mm-hmm. And still not helpful?
No.
Yeah, and just because the air is still probably permeating through that thin membrane, you might want to look at a scarf, something heavier that would keep the air out.
Okay.
Mm-hmm. But it seems like, we don't want you to be on steroids long term because that can.
Oh, Lord, no.
Yeah. So
okay, my second question is.
Yes, ma'am.
I have a personal problem.
Okay.
I'm 61 years old. I moved here from Detroit 2006.
Yes, ma'am.
I'm sorry, 2010.
Mm-hmm.
I am 180 pounds. My weight is supposed to be 135 to 140.
Okay.
And I am depressed. I've almost signed myself in the hospital because I don't like it. It also is bothering me because of my breathing. I can't bend over. I can't run. I can't do normal activities because of my stomach. They had me to take blood tests, and I haven't seen the doctor since last year. I filed a grievance against the doctor and the hospital because I think it's wrong that you tell me to do something and then I never see you. So I got all these books on natural juices. I got a Ninja, NutriBullet, and I have all the ingredients, juice maker, and except I haven't started, but I tried it. But I need something that can clean out my colon. Maybe it's either my thyroid or my colon that needs to be cleaned out.
Yeah, your thyroid levels do need to be checked, but let me just tell you this.
Okay.
In terms of, the ideal body weight and all of that, again, we're going to have to go back to the ethnic differences. African Americans, it would seem, have a little bit more muscle mass. And so we are going to be a little heavier than the ideal body weight scale. So don't look at that and judge yourself by that because it's not completely accurate. You follow me? The other piece is with your new diet and with the juicing, make sure that you're not incorporating fruit juice because fruit juice turns to sugar, turns to fat. What you need to focus on juicing are the greens, so your spinaches, your kales, your celeries.
Boy.
Yeah. So
I think I messed up.
well, no, you can turn it around. And so I think that even though you're limited by you having the shortness of breath, I think your diet will go a long way to helping you drop weight. And for all of you out there, your diet is probably 70% of the weight gain. The exercise helps you burn it off, but it's what you intake that will do the most damage, but also have the greatest effect. So in your case, if you can't get out there and exercise, then you have to put in the fat burning stuff, like your spinaches, your kales, those things that don't have fat or bad fats that you're going to hold on to. But even though they tell you to blend, your citrus fruits and all that, stay away from that. You want to be on the greens.
Yeah, because I could drink a bottle of water, my stomach will swell up. It'll be till the next day when it goes down.
Well, yeah. And, there may be some other factors with that, but make sure that you're limiting your fats. Also, don't eat after like 7 or 8 o'clock at night because your body, especially if you eat carbohydrates like rice, bread, pasta, your body's going to hold on to that and turn it into fat. So,
okay.
My
last question is,
yes, ma'am.
I heard you a couple of months ago. You were talking about the water. Someone that I know at a company gave me a water thing that you put water in.
Yes, ma'am.
I don't even know the type. Well, you put the big jug of water on.
Yes, ma'am.
Okay, you were talking about the water that you sell at your store.
Yes, ma'am.
Okay, how and where is it? I live off a Harding Place in Nashville, but I need to come to you and talk to you person to person. I'm not playing with my life no more. I need some changes.
We are 1.5 miles from Tennessee Titans football's Nissan Stadium on Dickerson Road. So we're right next door to Harold's Chicken. Those of you who know where that is, 811C Dickerson Pike. And no, we're not on the Goodlettsville end, which is what everybody thinks we are for some reason. We are 1 mile or so from downtown.
Okay, so what's the name of the store there?
Pruitt's Discount Pharmacy.
Pruitt Discount Pharmacy.
Pruitt's Discount Pharmacy, yes ma'am. 811 Suite C, Dickerson Pike.
11 what?
Ma'am?
You say it's 11 what?
Yeah, if you look at the screen there, the producer just put up for you. So that's where we are. You can probably just Google it on your phone. It'll bring you right to us.
Okay. Well, I don't... Oh, okay, thank you. There it is, 811C. Okay, thank you. I'll be down to see you. My name is Freedom. Don't forget it.
No, ma'am. I won't forget. All right, thank you for your call.
Yes, ma'am. Keep on doing God's work.
Ma'am?
Thank you for doing God's work.
Yes, ma'am. You're welcome. That's what I was put here to do. All right, thank you. All right, bye-bye. All right, everyone, stay right there. We've got 2 callers. We'll be right back.